Welcome to Business Talk, and time to talk about healthcare in South Africa. And access to quality, affordable healthcare, we all know, is a major problem. I don't think any South African can say that we're happy with the inequality in access. And my next guest is certainly not settling for the status quo. Joining us is Roberta Gumede, who is a marketing director and co-founder of Lulame, which is a company which is at the forefront of reshaping healthcare access across South Africa. And Roberta will be well known. She brings a wealth of experience in strategy and marketing with a remarkable knack for bridging cultures and economies from East Africa to South Africa and even further afield. And today we're going to be exploring how Lulame is revolutionizing the way healthcare is delivered in high-density urban areas through their modular healthcare units. Roberta, it's just such a pleasure hosting you on the show to talk about what is something that's certainly very close to my heart. And I think often what gets lost in the NHI debate is that we need to be ensuring that we improve access to affordable quality healthcare for all South Africans. Now, why do you think we have this big gap between rural and urban healthcare access? Why is this the case in South Africa?
Hello, Michael. Thank you so much for having me. And I'm really interested to have this fireside conversation with you as we unpack this very important conversation. I think it's important to lay the ground that I joined and co-founded Lulame because of the very passion that you have. For me, I often think about the grandmother who lives in rural Eastern Cape, rural KZN, and her granddaughters living in Joburg, and how do they manage healthcare for the grandmother who necessitates it and the distance of living in urban South Africa. So from a premise, I think we must contextualize this conversation around there, because that is ultimately what I aim to solve as an individual, and of course what Lulame from a greater Africa perspective aims to deal with. So you asked me around why do I think there's such a disparity between urbanization and the rural landscape. I think in a country like South Africa, we cannot ignore what history has contributed to that. Because of our apartheid history and Bantu stands, we do have deep urbanization in cities such as Johannesburg, Cape Town. But the more you go into the outskirt townships, Khayelitsha, we see that disparity in accessibility. And then, of course, as you go into the very rural Stangers, KZN, Isla in the Eastern Cape, there's such a deep desperation for infrastructure and accessibility. So I think from a South Africa perspective, that is really at the crux of why we have this issue. We just haven't been able, in our 25 years of democracy, been able to invest enough foundational infrastructure to ensure that the citizen journey in a Johannesburg and in a Deep Isla is par to each other.
Yeah, and I mean that history is something that, as you say, we've really grappled to overcome and to rectify, and I think it manifests in so many different ways. From your vantage point, how do you see it manifesting, this lack of access to quality healthcare and this inequality that we see between the urban and the rural locations in South Africa? How does this translate into the broader societal issues that we're confronted with in South Africa?
Yeah. So I think one of the biggest things where we've been able to see impact is the lack of access to healthcare means that individuals are not able to have as good of a lifespan. If we think of it from an economic perspective, a big part of what the government needs to do is to be able to really churn out a good workforce that's able to deliver in organizations, so we continue to grow our GDP and really stronghold and sustain ourselves as South Africa. A lack of access to healthcare, particularly outside of the node of cosmopolitan urban South Africa, means that we have an entire workforce that's not able to be a part of the conversation. And so from a macro perspective, this is why we need to be able to bring healthcare to the people. We need to be able to start really laying the ground and cultivating rural and township economies, so we're able to get to a place ultimately where we as South Africa, all the continents at large, is able to sustain themselves. I think the challenge why we haven't been able to see healthcare really coming about in the stronghold in the rural network. And what I don't want to do is focus on what has happened during apartheid. I think as private sector, We need to be able to accept that this is our history, and we need to rather think about ways to solve where we are, as opposed to saying, gosh, the government is not doing enough. Realistically, me
Yeah.
and you both know, Michael, that there isn't enough funds to deploy in the urban area as it is. Yes, there may be hospitals, Charlotte Matlege does stand, but even there, service delivery continues to be a challenge. And so we must be able to look and say, okay, government, you take care of what you already have built. And us as private sector, let's hold your hand and really invest in the nodes that sits out of that skirting. So we're able to ensure that all South African citizens, as per right, are able to access that healthcare. I think the challenges we have there, one is deep infrastructure. There is no technological line connectivity infrastructure. And you and I both know that in the premise of telemedicine, this is an opportunity we're not able to today engage on because it just doesn't exist. Second, the lack of road network and infrastructure in the rural network is tiresome. For me, Ana will always be a really poignant memory. I went there maybe 5 years ago to visit someone, and I grew up in urban Johannesburg, right? I don't have family that comes from the rural land. And so it really, for me, was moving to realize that, gosh, once I pass a Butterworth, once I pass any of the big towns or small municipal hospitals or clinics that they may have, in Lower Kala, there's nothing. Absolutely nothing. And the challenge there is when it rains, you do not move. That is the reality.
Wow.
And so I think of myself and possibly having a grandmother who lives in a circumstance like that. Even if I know that she's diabetic, even if I know that she's going to have a heart attack, even if I know that she's in line for a stroke, what can I do sitting in Johannesburg? How do I meet her needs? And the reality today, I cannot. My money cannot save my grandmother. And that is something that I think is just a very deep injustice. So I think Lulame aims to address that, to be able to deploy our containers anywhere, any terrain you have. We're ensuring that the individual is able to walk from the doorstep of their house to be able to access that. And Michael, it doesn't solve the entire value chain, but it absolutely is a start. And then, of course, the third challenge that we have is because we have a lack of economic activity within the rural areas, getting doctors to migrate into those areas continues to be difficult. And it makes complete sense. I've spent 7 years of my life attaining a degree. I have to spend 2 years of that really passing over my skill set at a community clinic. And just as I'm ready to start earning a living for myself, I need to plow myself out and go live in a rural network where all the things that matter to me, all the things that matter to my kids are not available. We need to do more to find avenues and ways that allow individuals such as those to be able to practice in those areas. And I think starting up hubs of economy around those areas really at least allows us to start exploring what it may look like in 10 years. And of course, in parallel to that, we have a deep, deep network of nurses that are retiring year in and year out. The skill doesn't retire. The age matures. The skill doesn't retire. So one of the things we've looked at is to say, how do we continue to allow those people to practice in any sort of capacity? Because the truth is, she is most likely going to retire at home. She is most likely going to live in Deep Ala or Deep KZN. And perhaps we have an opportunity to allow her to continue to serve the people within those communities with the deployment that we have. Sorry, that was a mouthful.
Fascinating. No, it's fascinating. And I was kind of hanging on every word there because there is so much to unpack, from the lack of infrastructure to the public-private partnership approach, which is so necessary. And I'm so encouraged because it's a theme that we're starting to see emerge in South Africa. For too long, I think the private sector maybe did stand back and say, right, that's the government's terrain. This is our lane. We'll stick in our lane. Government, you stick in that lane. But we're realizing that the challenges to solve are just intractable to try and solve them alone. So we've got to solve them together. We've got to take hands. but these are difficult challenges. The infrastructure challenges are not going to be solved overnight. You can design a fancy app to hail an ambulance in case of an emergency, but if the ambulance can't get there, well, it's all for naught. So I think that's, and the skills and training issue, I mean, that's just a fantastic way to ensure that we don't lose that experience that the Gorgos are bringing into, as nurses, into their own home rural communities. How are you using these modular healthcare units from a tech perspective to help deliver on all of these potential promises to help bridge the gap between what we see in the rural locations and our urban sectors?
Sure. So from a tech perspective, I'm going to start with the auxiliary things and then really zone in on the HIS tech, which is really at the heart of Lulame's tech drive. So, of course, on the container, we have biometrics and security continues to be an issue in those environments where there's a deep sense of community. And we know that the community at large will look after the container. The reality is in areas like that, you still have a deep sense of theft that happens. And so we've put in biometrics that is able to be monitored anywhere and everywhere. So if you are a gogo, if you are a nurse who owns a container, you'll be able to ensure that the safety of that container and the cameras around it are able to keep you going. The second is the containers come with plumbing. So we're water ready. No matter where you plug us in, we're able to thrive. And so that is really important from a sanitization perspective. Containers further so come with solar panels on the roofs. And this is important because, as you and I spoke, from an infrastructure perspective, there may not be an electrical line. But in order to tap into things such as telemedication and to be able to access the HIS solution, we need to be able to be electricity efficient. And so the solar panel will come with that already embedded. I think really at the heart of it is this HIS solution. I'm a big lover of data and the endless opportunities that accessing the right data and aggregating it has, particularly from a planning perspective, but more so from a citizen and country planning perspective. I can imagine a world where, again, I'll use the euphemism of my grandmother in Loakala or an aunt perhaps, where today I'm able to access her symptoms from an HIS perspective. And in 5 years, with the help of AI, we're able to suddenly predict and say that, okay, Roberta today has this illness, but perhaps in 5 years, with the relationship she has, in the work that she has, in the work that she does, in her diet, etc., we know that this 31-year-old is susceptible to XYZ ABC. And so Kijima, one of our partners, in Lulame, has deployed an HIS, an HIS solution that essentially offers a one patient, one record. And that means that we're able to, from the day of visits, be able to track whatever your illnesses is, and we're able to grow the data alongside yourself. This gives us 3 opportunities. 1, we're able to trace your own health journey. This means whether you're seeing a clinician in Loakala, or you're visiting your child in Johannesburg, or you're going on a trip to Cape Town for an anniversary and you fall sick, you have your records accessible. Today, the average South African who lives below the middle class doesn't have those records. They are printed on paper. If they lose their CT scan, if they lose their blood results, they have to do it all over again. And this means that the government is spending copious amounts of having individuals retake tests. But it equally means that people are not getting diagnosed at the right time because not the right data is accessible. The second is from a very macro government perspective, we're suddenly able to map out illnesses that happen in particular regions and particular areas. So by collating all of that data, and ultimately what we'd like to see as a Lulame, if you will, like clinic chain, as a concept, that data now is able to say to us, in the Pala region, these are your challenges. And this is where you need to start taking a lot more focus. And this is how we can change sort of a genotype, if you will, or environmental circumstances that affect those individuals. And then, of course, you and I spoke around AI, that predictive elements that we can today start mapping and saying, gosh, we've got to build more specialists in cancer. We've got to build more specialists in schizophrenia because we're able to see an upgoing trend and we have to deploy them in these particular areas. So we can curb the amount of people that have to go to tertiary hospitals. We really need to be able to much better manage the traffic of individuals who go to the state-of-the-art hospitals, because that must be at a criticality that is necessary for it. Today, it's frustrating. An individual who has a flu wants to sit next to an individual who's dying of cancer. And we need to be able to better manage how those individuals are tiered according to the different hospitals. So the specialists are really focusing on patients that need to move the needle, and the generic conditional flu, chronic illnesses that have been attended to can be done so at a much lower level without congestion.
Yeah, that it's almost like a digital triage that you can develop with all of this data. And it's about being preventative and proactive. And in data we trust, as they say, as well as God. But everyone else bring data is the old adage, I think they say, in the data science field. But I mean, this all sounds fantastic. Aren't we talking about healthcare, though, which is really heavily regulated? And I mean, one can understand why, when you're delivering healthcare services and, doctors, as you say, have to study for 7 years plus community service. How have you navigated the healthcare regulations to develop and build these units? And is there anything that government could do to make it easier to help deliver solutions like yours, which make so much sense?
Absolutely. So what we've done is we've partnered with one of the co-founders, is an organization called Hermetic, and they specialize in building modular units, particularly for medical use. What this means, Michael, is our containers can service a GP who sees an individual with a nagging headache that won't go away, but equally the exact same unit built to spec can help a mother deliver her child. And so from an infrastructure perspective, we've ensured that the building blocks that live within the healthcare unit are at a standard that it doesn't limit anyone within the rural network of accessing the procedure the procedure that they need at any given time. So I think important to add that from a regulation perspective, our healthcare units have been signed off by the standards of WHO, for example, CDC, which set the limitation and the groundwork for what hospitals must be standardized to, and of course what modular units must be standardized to. So we're quite comfortable that we're able to deploy these units in a safe and efficient manner, where we don't have to worry around contamination of patients or of patients' blood work, for example, in those particular areas. I think another big thing that's important is it is built to last in the South African or in the African climate. We're able to build the containers in a very short amount of time, a lot shorter than a hospital brick and mortar, if you will. And so this means that we're able to bring the solution to the people on demand. It takes us a good 2 to 3 weeks to get the container up and running at the standard spec. And you can drop it and get a doctor in there, and it can be activated immediately. The containers further have Wi-Fi connectivity, and this means that even if you have a clinic, for example, working the container, you're able to then dime in a doctor who's able to then assist once the initial processes have been taken with the patients and the initial data has been captured. So from that perspective, we're quite confident that we're delivering a solution that we have taken through the rigor, we have taken through the red tape, and we're quite comfortable that it will be able to sustain with and live.
But good. Are you finding it a process that, even though you've gone through the red tape, is still difficult to deliver from a government regulation perspective? Is there a way that government could make it easier to deliver these solutions?
Yeah, absolutely. Government is, of course, a big stakeholder in our rollouts because we ultimately aim to better the citizen journey and access to healthcare. In Cape Town, we had proposed a 148-bed hospital, and in principle, we got that signed off. Because we weren't given a site, at the time, government wasn't ready to come on and deploy this or roll it out, if you will. But from a regulation perspective, we've ticked that off. A big goal of ours is to be able to take every municipal manager through our container and show them the solution. Show them what this can do, show them how it can alleviate their problems, and really show them that we are a partner in this. We really want to be able to hold their hands, and we want to be able to pull in different partners in the private sector to be able to deliver this very necessary solution. So a government outreach is highly important. Today, we have a container that sits, we launched last year in October, and we have a container that sits in Olivendale. In reality, I would have loved to take a container into rural Stanger, if you will. But from just a marketing logistics perspective, and in truth, my stakeholders sit in Johannesburg, Cape Town. I launched it in Olivendale, which is really a marginalized, a difficult township to live in. But it most closely mimics the reality of where New York will be. And we've seen great success. In fact, we've tried to remove the container because the agreement was we were going to showcase it there for 3 months. So the community and municipality is able to understand how it works and really open the conversation with the local government to say, how do we roll this out in South Africa? And when we came to pick it up, the community stood against us and said, absolutely not. We want to be able to keep this container here because this container is doing the work and it's meeting our needs.
Wow. I mean, that's the most ringing endorsement you could probably hope for. And it also just shows you what a demand, what a need there is. And, once municipal managers, once local government, once provincial and national government see what this can do, it will then free up resources to focus on, in terms of NHI, getting the clinics and hospitals under their responsibility and purview up to the right standard to contract through the Office of Health Care Standards with that centralized scheme. So this really helps in the broader picture in terms of government policy as well. So we wish you everything of the best in trying to ensure that government sees the value here, because I think it's fairly obvious once you get through the right doors. Talk to me a little bit more about your approach to social responsibility through the various initiatives that you've run as well, because it's also, I guess, about building trust within communities.
Absolutely. It absolutely is about building trust in communities. You and I have spoken of the Gogo who returns post-retirement. And so for her, we really want to be able to allow her to be entrepreneurial. We have a big push, and we've worked with, we're engaging with the nurses' unions to be able to see if we're able to create a next lease on life, if you will, where we're able to offer those individuals an opportunity to own a container. We've come up with some funding partners who are able to then support them through the ownership of their container, and they're able to deliver the service. Lulame is able to help them to manage from an IT infrastructure perspective to ensure that their clients are met. And of course, we have another partner who works with us to ensure that medication reaches them ultimately. So from a CSI perspective, that's a very big entrepreneurial push that we have. And of course, this is not just ring fence to the global. It equally, absolutely, is an opportunity that stands for the graduates who has just come out of university, has served their COM, and they equally have both a medical and entrepreneurial spirit, and they want to be able to solve some of these issues. We are more than happy to engage with those individuals to be able to help them start solutions and really roll with the needle. The second to that, of course, is the old CSI play. We, in large business, you and I both engage with large businesses consistently, and we know the amounts that need to be spent on CSI. I think in the past years, we've seen, seasons where the allocation has been correct, but a big question is always, has where we've put our money really moved the needle in a sustainable long-term perspective? And myself, a leader in a big corporate, I'm consistently asking that question to say that where we're investing our money really is in 10, 15, 20 years. Will we be able to see the impact of this? And I think seeing the impact through one individual and sending them to school is one thing, but I really want to see a mass impact. I want to see a social impact. I want to see an entire community be changed. And so we have a big request to equally partner with big corporates. And these are corporates that either have a passion for a particular rural sector or a particular rural place, or they operate within a particular rural node. Tourism businesses have lodges, incentives that are typically rural. They hire a lot of the workforce in that area, but in truth, those individuals are still unable to access the healthcare that they need. And so we want to be able to partner with them. Mining is another very big, great example where they continue to do their work in these outskirts, and how can we be able to bring those solutions forward? And then, of course, you may have a CEO who comes from a district like that, who grew up in the dirty sands of a Pala, of a Stanga, who may want to invest his own money behind it. And this is absolutely an opportunity to be able to do that.
Yeah, and I'm also just thinking as you speak of a renewable energy company in the Northern Cape, for example, which is quite remote and partnering in its own CSI initiative on this. So huge scope, massive opportunity. And you said earlier you want to see this Lulame network blanketing the country, which would then really be that kind of scaled impact that you spoke of. So what are your future plans to continue bridging this gap between rural and urban healthcare access?
So absolutely, rolling out the network is definitely a key pillar of our future plans. And I think we need to, we're at a stage where we're really trying to chisel out. Does that mean that Lulame rolls out its own clinics, which is absolutely an opportunity? But in reality, we're a business that's focused on bringing the solution to the people. We want to partner with individuals who are able to roll out and roll out the business and take care of the business by themselves. So the entrepreneurs, the stakeholders are a big part of our strategy to be able to ensure that it's rolled out. The second is building a center of excellence. You'll see across the IT space, there's big conversations around centers of excellence and bringing best practice at the touch of the finger. So we ultimately want to be able to take the best of the best across this network, bridging both urban hospitals or the hospitals that sit within private sector and public sector, and be able to bring them in a network where we collectively can start to fight some of the challenges that exist from a healthcare perspective in both urban and rural. And telemedics is a big proponent of that. I want to be able to dial in the specialist while I sit in rural Tyler. And the proficiencies and data and systems to be able to do that is a big long-term driver for us. Today, we're doing the brick and mortar work. We're putting down the containers so people can access them. But again, in 4 or 5 years, it's about being able to crunch that data up, look at it with the best eyes that the continent has to give, and really start mapping out what healthcare looks for us. And then lastly, it's to be able to assist government from an NHI perspective. NHI, I don't know how much of it you've been through, but NHI aims to address some of the challenges that we're seeing in urban South Africa. But I think from a large perspective, we remain silent on what's going to happen in the rural network. Of course, the HIS system, should it ultimately be connected, gives us an opportunity where we have an entire footprint and mapping of all citizens across the country and ultimately across the continent in how they walk. But we ultimately want to be able to work with government to say, okay, while you look after what happens in urban areas, let's look after what happens in rural, and ultimately let's ensure that that data language is able to speak to each other, so we're able to deliver one cohesive citizen journey, and ultimately we can make Gogo's life, Gogo's journey through healthcare so much better than what it is today.
Wow. And what could be a higher purpose and a more audacious goal than exactly what you've just described? Roberta Gumede, thank you very much. We're going to have to leave it there. Marketing Director and co-founder of Lulame, taking us through this journey of reshaping healthcare access in rural South Africa here on Business Talk. Take care.